Think about what you did this morning when the alarm went off. Did you try to reach your arm out to turn it off and feel that familiar, deep, sharp catch in your shoulder? Or maybe your worst battle was in the middle of the night, trying to find a sleeping position that wouldn't make you wake up with a constant throbbing pain. The way you sleep, how you sit at your computer, and the small movements you make while getting dressed might be feeding a daily cycle of inflammation and severe pain. Welcome to Rehab MD Insights. I'm Dr. Matthew Rhodes. Today, we need to have a serious and detailed conversation about your shoulder. If you've been told you have tendinitis, if you can't lift your arm above your head, or if your shoulder just constantly aches, you are in the right place. Unlike your hip, which has a deep bony socket, the human shoulder is the most complex and mobile joint in the body. It works like a golf ball resting on a small tee. To keep from falling off, it relies entirely on a complex web of muscles and tendons. This massive flexibility comes at a price. A high vulnerability to injury. Most people immediately assume that any shoulder pain is just a passing tweak. But modern medicine shows us that there are three distinct main culprits, and treating the wrong problem with the wrong exercise can drastically worsen your situation. Let's break down the three most frequent diagnoses. Culprit number 1 is rotator cuff syndrome, frequently associated with subacromial impingement. Imagine your shoulder tendon as a thick rope passing through a narrow hallway. The roof of that hallway is a bone called the acromion. Rounded shoulder posture may reduce the available subacromial space and alter shoulder mechanics, increasing stress on the rotator cuff tendons. When you lift your arm, mechanical compression and tendon overload may occur. Over the years, this friction causes micro tears, inflammation, and sharp pain when lifting your arm or reaching for objects away from your body. The second major culprit is frozen shoulder, clinically known as adhesive capsulitis. This condition is incredibly painful and frustrating. The flexible capsule that surrounds the joint becomes severely inflamed, thickens, and forms scar tissue. It's like trying to move your arm while wearing a stiff leather jacket that is 3 sizes too small. It's not just weakness. The shoulder becomes physically blocked, drastically losing its range of motion, especially when trying to rotate the arm outward. The third culprit is shoulder osteoarthritis. Unlike the wear and tear of tendons, the problem here lies in the cartilage, the protective gliding layer that covers the bones. With age or after old traumas, this cartilage wears away. The result is bone rubbing against bone. The pain of osteoarthritis is described as a deep ache, a mechanical grinding inside the joint, accompanied by intense stiffness, especially in the morning when waking up. Now that we know the enemies, let's talk about my patient's biggest complaint. Doctor, why does my shoulder hurt so much at night and keep me from sleeping? This is a maddening pain. During the day, gravity pulls your arm down, which helps to slightly open that hallway where the tendons pass. But when you lie down, gravity stops doing that job. Furthermore, when lying down, changes in shoulder position and pressure within the tissues may increase pain sensitivity and discomfort at night. How do we fix this? We need to adjust your sleeping position. If you like to sleep on your back, the mistake is letting your arms fall to the side. This stretches the front of your shoulder and pushes the arm bone forward, stretching irritated tissues. The solution: place a pillow or a folded towel under the affected arm, from the elbow down to the hand. This aligns the shoulder in its most neutral anatomical position, taking the tension off the rotator cuff. If you are a side sleeper, the golden rule is never to sleep on the shoulder that hurts. That directly compresses the bursa and the inflamed tendons, guaranteeing pain. Lie on your good shoulder. The arm of the painful shoulder should rest on a large, thick pillow that you will hug against your chest. This prevents the arm from dropping across your body during the night, keeping the joint open and blood flow circulating freely. These small biomechanical changes can significantly reduce nighttime discomfort for many people. Sleeping better is the first step to allowing your body to heal. The second step is smart movement. Prolonged complete rest is usually not recommended for shoulder pain. If you stop moving it completely, the capsule shrinks, and prolonged immobility may increase the risk of stiffness and frozen shoulder. We need to strengthen the stabilizing muscles, but in a safe way. Let's look at 3 fundamental, commonly used evidence-based rehabilitation exercises you can do at home. But before we begin, a critical rule. Stop any exercise that causes sharp worsening pain, numbness, sudden weakness, or significant symptom aggravation. The passive pendulum. This exercise is effective because it uses gravity to your advantage. Support your good hand on a chair or table and lean your torso forward, letting the painful arm hang freely toward the floor. Now gently rock your body so that the arm makes small circles in the air. The trick here is not to use your shoulder muscles to move the arm. Let the swaying of your body do the work. This creates a gentle traction in the joint, promoting gentle joint motion and reducing stiffness without any pain. Do this for 2 minutes. Number 2, scapular retraction. Remember, your shoulder rests on your shoulder blade. If the foundation is bad, the house falls. Sit up straight. Pull your shoulders slightly back and down, as if you were trying to squeeze a pencil between your shoulder blades. Hold this contraction for 5 seconds and relax. Your breathing should be normal. This movement may improve scapular positioning and reduce stress on irritated tissues. Repeat this 10 times. Number 3, isometric external rotation. Isometric means contracting the muscle without moving the joint. If there is no movement, there is no bone scraping against the tendon. Stand next to a wall. Bend your elbow to 90 degrees and glue it to your ribs. Now push the back of your hand and wrist against the wall, as if you were trying to push your arm away from your body, but the wall stops you from moving. Push with about 30% of your maximum strength. Hold for 10 seconds. Feel the muscle working deep inside without any joint pain. Do 5 repetitions. I want to be completely honest with you. These adjustments are the foundation of orthopedic rehabilitation, but it's crucial we know how to distinguish common inflammation from something more dangerous. If the pain started suddenly after a fall or trauma, if you have excruciating pain that not even prescribed or over-the-counter pain medication relieves, or if you have a total inability to lift your arm on your own, falling heavy at your side. These are clear signs of a complete tendon tear that may require urgent medical evaluation and, in some cases, surgical treatment. Additionally, seek urgent medical attention if shoulder pain is associated with fever, redness, major swelling, chest pain, or sudden neurological symptoms. When you visit an orthopedic surgeon or a physiatrist, know that surgery is almost always a last resort, reserved only for the worst structural tears or end-stage osteoarthritis. If exercises aren't enough, we use minimally invasive options. The first is a rigorously ultrasound-guided cortisone injection to deliver the anti-inflammatory exactly into the affected bursa, turning off the pain alarm. For frozen shoulder, we can do a hydrodilatation, where we use sterile fluid to expand and stretch the stuck capsule from the inside. Your shoulder is your tactile connection to the world. It's what you use to hug your loved ones and reach the highest shelves of your life. You have the tools. Try the sleeping positions tonight. Start the 3 simple exercises tomorrow morning. Leave a comment below and let me know if sleeping, hugging the pillow made a difference in your morning stiffness. If you found value and hope in this information, please subscribe to Rehab MD Insights and share this video with that friend or family member who is always rubbing their shoulder and complaining. Knowledge is the first step to healing. I'm Dr. Matthew Rhodes. Stay active, stay hopeful, and I will see you in the next video. This content is intended for general educational and informational purposes only, and should not be interpreted as medical advice or used to diagnose or treat any condition. Always seek the guidance of a qualified healthcare professional regarding medical concerns or emergencies. Thanks for watching. Please leave a comment and like this video.